Your responsibility in that is to think ahead. What is my expected outcome and what complications could arise because of the action that I'm taking right now? Collaborate and clarify to help yourself think ahead. Nursing is a constant game of thinking ahead. What is likely to happen if I do this step? What might happen next if I don't do this step? What complications might happen? What outcome am I expecting? And that's part of any implementation. As you're about to give a medication, about to do a procedure, your responsibility in that is to think ahead. What is my expected outcome and what complications could arise because of the action that I'm taking right now? So collaborate with your educator, with your charge nurse, with that seasoned nurse. Ask why. If there are any steps in the process that aren't clear to you that you don't feel masterful with. Another great example is when I came back into nursing, like my second or third shift, I needed to access a port. Y'all, it had been probably 6.5 years since I had accessed the port or even reviewed sterile process or procedures on accessing a port. So I pulled up the policy, I read through the evidence-based practice steps to refresh myself, and then I asked a seasoned nurse to come be at the bedside with me as I went through the steps to make sure that I didn't forget something important. Okay, that was me saying, I need your collaboration because I'm not feeling confident about reading this skill independently and safely. Like, I don't want to give this patient a central line infection because I'm prideful and didn't want to ask for help or clarify. That's dangerous. The second that you start practicing nursing and you're uncertain of the steps, you don't know why, you're not sure, and you don't ask for collaboration, that's the second that you become dangerous. Let me just lay it out there right now. Like, let's not be confused. That's dangerous nursing. The end. Ask the questions, collaborate, clarify, think ahead. This is your job as a nurse to develop these skills of critical thinking and to not be afraid to reach out, to use your resources. Do your diligence before you take action because everything you do or do not do for that patient could have, is going to have an outcome. It's going to be either good or it's going to be bad, depending on how you approach it. And that's the responsibility of having that RN behind your name.